Welcome to miniEM. Here's how to make eyelid retractors out of paper clips. Sometimes you need to examine a patient's eye, but it's either too swollen shut or it's painful for them to open. To get your exam, you need eyelid retractors. Some emergency departments stock eyelid retractors, but they're pretty rare. One easy and relatively safe way to make your own is by using 2 paper clips. You can usually find these anywhere in the department. Wipe down your paper clips with an alcohol wipe and inspect them for any metal shavings or any sharp edges before you use them. Try to find the kind without ridges on them. Take one end of the paper clip and bend it, creating a loop on the end. Imagine trying to make a hook to hook your patient's eyelid. Do this to a second paper clip too. Now, make sure that you have anesthetized your patient's eye before you do this. It shouldn't injure the eye, but it's pretty painful to have done. Even if the patient is super swollen, you can usually sneak a few drops of tetracaine or proparacaine into either the medial or the lateral canthus. You really just need a small amount of anesthetic to coat the epithelial surface of their eyeball and their inner eyelid. Pull down on the lower lid with your finger and place the paperclip hook between the globe and the lower lid's mucosal surface. Then do the same thing for the upper lid. Have an assistant hold these in place while you examine the eye. As always, avoid putting pressure on the globe and keep the sharp edges away from the globe. That's all there is to it. Check out the rest of our miniEM library for more eye education.